Hello, and thank you for joining us for our Facebook Live about COVID-19. I'm Elizabeth Van Camp, a member of the UI Healthcare social media team. Dr. Teresa Brennan, Chief Medical Officer at UI Hospitals and Clinics, and practicing physician specializing in cardiology, and I will be discussing how we're keeping staff and patients safe, things you can do to take care of your health, and busting those myths and misinformation out there about COVID-19. So thank you for joining us today, Dr. Brennan.
No, you bet. Good to see you.
This is a live broadcast, so please comment with any questions you have, and we'll get to as many of them as possible. Before we begin, this video is for informational purposes only. So if you feel sick or if you're concerned about your health, we encourage you to contact your primary care provider or schedule a video visit with one of our providers. So let's get started with a question that was actually presented to one of our providers last week. Is this virus real?
Yeah, I think it's a question that maybe not just a few people might have. There's a lot of things in the media that are causing people to be a little uncomfortable and maybe distrustful of the news that's being broadcast. And so we want to make sure that everyone listening knows that I know firsthand that this is real. I mean, I've seen patients. I have not taken care of patients yet. But I've seen patients with it. It is a definite new diagnosis that we have to deal with now and probably for a while.
Great. So there's some confusion out there about the difference between the term coronavirus and the term COVID-19. We even have researchers here at the university that do research on coronaviruses. Can you explain the difference between those two terms?
Sure. So coronavirus is a family of viruses. We know that 4 of them actually cause symptoms like the common cold, and they've been around a long time. 2 of the coronaviruses we've seen over the last several years cause some outbreaks. One was MERS, the Middle East Respiratory Syndrome virus, and the other was SARS, oh goodness. I can't remember at the moment what it stands for, something acute respiratory syndrome. COVID-19 is the disease that is caused by the last coronavirus that we are aware of, the novel coronavirus, SARS-CoV-2. And so the COVID-19 is the identification of the disease that virus causes. But it's caused by one of the viruses in the coronavirus family.
Okay, that makes sense. Thank you.
Severe acute respiratory syndrome.
You knew it would come back to you at some point. Can you explain to us what the difference is between COVID-19 and the flu that we see every year?
Sure. I mean, the first thing is that they're caused by 2 different viruses. So the flu is caused by influenza, which is in a different family. And COVID-19 is, as I said, caused by SARS-CoV-2. They tend to appear the same when patients start to get symptoms. The symptoms are quite similar, which is why I think it was interesting how the diagnosis evolved, because people thought they had influenza, but they were negative for influenza. And so what is this new constellation of symptoms? The other thing that's different from influenza and COVID-19 is really the mortality. So more patients who get the virus will die of COVID-19 than generally die of influenza. That shouldn't give us a lot of comfort, because influenza does kill tens of thousands of people per year. But it does make us worry a bit more about COVID-19. And I guess the last thing I'll say is that influenza has a similar pattern, really no matter who you are, whether you're young or old. The symptoms are pretty similar. What we see with COVID-19 is that there are some populations that have much more severe course and a higher likelihood of potentially even dying. And that tends to be seen in the elderly and maybe some other populations. And that kids tend to have different symptoms, that their symptoms may be even less severe, more like the common cold.
Wow. So that's it's quite the variation. So it's a little harder to get a handle of than, like you said, than the flu, which we have a lot of knowledge about.
Yeah, I mean, we've said this before. We're learning a lot. Every day we're learning more things about COVID-19. I think that the most important thing for the viewers to remember is there's a fair number of similarities with respect to the symptoms and what happens to patients, but there's a lot of differences in the outcomes, and obviously the virus that causes each disorder is different.
That's great. Thank you for sharing that. As states open back up, including Iowa, and loosen restrictions on the public, should people take fewer precautions just because the state is loosening those restrictions, or should they continue practicing social distancing and wearing face coverings?
Absolutely continue all the safety standards that we've been talking about since the beginning. Um, the opening up of the communities is really thought by our politicians to be necessary to maintain the economy, to maintain normal, get back more toward normal life for all the individuals that live in Iowa and in our nation. That is not to say that this is over. This is not over. And it would really be a shame if we were to lessen the restrictions on ourselves, those safety standards that we each should be following, washing our hands, making sure that you wash for the appropriate amount of time or use hand sanitizer very frequently. Remember, anytime you touch a surface, to not touch your face, to wear some sort of face covering when you're in a place where other people are. So you and I are both in rooms by ourselves, so we're not wearing those right now. But on my way to this room, I wore a face shield, which is what we are using to cover our faces and keep us all safe. It's really important, and I will tell you that, I was picking up groceries in the, online pickup this weekend, and I saw a number of people going into the grocery store and coming out that had no face protection on. They were side by side, so clearly social distancing wasn't happening. And this is really not about judging people or getting upset with people. It's really about educating people that we really have to continue these safety standards. They're good, normal things we should do every influenza season. Try to keep us safe. And I think now with COVID-19, that these are things that we're going to continue to do for a long time.
Yeah. So speaking of the face masks, I saw the same thing. I saw a lot fewer face masks at the grocery store this past weekend. But I also saw a lot of people taking off their masks like this.
Yeah.
And we know that the outside of the mask we should consider contaminated. Can you just remind us of, how we should be removing that to be safe?
Yeah. So when we're talking about medical masks in particular, you want to think about the outside being contaminated. When we're talking about cloth masks, it could be the outside or the inside, right? Because cloth masks are really about source control, about making sure that the person wearing that mask doesn't, have droplets that are getting to other people. So I think both, it's really important to be cognizant of that. When you're taking off your cloth mask, you should remove it from your ears if you have ear loops, or untie from the back if they have ties. And then ideally, you put it in a paper bag or something, a place where it can be protected and where it doesn't contaminate the surroundings, and then straight into the laundry. I think really important that we remember that our cloth masks have to be laundered regularly, just like our clothes.
And can you touch on for us why it's important for everyone to wear some sort of face covering right now? Because it's source control.
Right.
And so when everyone wears one, it's really beneficial, right?
Yes. So remember that this is a virus that gets passed by droplets. So when you cough or you sneeze, those droplets can get out into the air. Source control is really about not letting what comes from me get out into the air, fall onto surfaces, contaminate other people, or potentially have them become ill. And you may look at me and you say, well, she doesn't look sick, so why do I have to worry about that? Initially, we didn't think that people could be carriers of this, that people could be asymptomatic and have the virus. And now we know that that's not true. We know that there is a certain percentage, and that percentage really varies by population and by community. And we don't really have a good number for that, but there are some people who do not manifest symptoms, or they might be in the early stages and tomorrow they might have symptoms. That we could test them and they would be positive today. So we believe that they could transmit potentially if they happen to sneeze or have just, an unusual cough. It's allergy season, so those things are happening now. And so in order to control the source, it is important for us to wear cloth masks. And each of us might feel like, well, we feel fine. It's not necessary for me to wear it because I feel fine. But the reality is that you don't know. And unless we all do this, then we're not protecting each other.
Great. So we've got a few questions from Facebook about face coverings, so I want to get to those while we're on the topic. Marcy asks, when going in public, is a cloth face mask the best protection, or does a clear face shield offer better protection?
Yeah, it's a really good question. And I can tell you here at the University of Iowa Hospitals and Clinics, we chose to use face shields. And the reason we did that was because in the early outbreak, it wasn't clear that we were going to have masks for everyone. We were hearing and seeing that nationally and internationally that masks were in great shortage. And we wanted to have something that was reusable. The face shield also offers a couple of other advantages. One is that it covers your eyes. And the second is that when you have your shield on, you have to actually try to touch your face. You know, most of us just normally bring our hands toward our face, and we might touch our face several times an hour even, depending on who you are. It's just a habit that we have. But with a face shield on, you can't touch your face. So we feel like the face shield offers great benefit. We believe that it offers source control as well, and that's why we have our employees wearing it. A cloth mask is a reasonable alternative for source control when you're out into the community. The challenge with a cloth mask is that each of them is made differently because they're made, you know, by hand. And so some may be better than others. We do know that cloth masks are not the same as a medical mask. There are certain kinds of medical masks. One is an N95 that is very good at keeping particles out, 95% of the particles. That's why it's called an N95. And then we have isolation or surgical masks, which are not quite that good, but still very good. And then cloth masks are much less good at keeping things in or out. And so I think what I would recommend is to take a look at what's available to you. And if you have both available, there's nothing wrong with wearing both. I can tell you I went to one of the stores recently and I wore both because I think that there are some advantages to both. It's hard to wear those for a long time, though. A good shout out to our healthcare workers who are wearing their shields and wearing their masks for long durations as they're taking care of patients. It's hard.
Absolutely. Yeah. Well, we've got, thank you for all that information. I didn't know some of that information, like the 95. That makes total sense. So Erica asks, do you need a face covering when coming to an appointment at the hospital or one of the clinics?
Yes. We would love if you have a cloth face mask that you wear it when you come in. But don't worry, if you don't, we'll actually give you a mask when you get here.
Great. So let's see, what treatments are effective against COVID-19? And I'm asking because there's some belief out there that things like maybe sunlight or other natural remedies can protect you or treat you if you have COVID-19. So can you shed some light on the facts there?
Yeah, unfortunately, as we've gone through this outbreak, there's been lots of things that have been in the media or in print that have said, sunlight kills COVID-19, and then the next day, sunlight doesn't kill COVID-19. So I would suggest to the viewers that they really focus on what we know to be true. What we know to be true is that COVID-19 is actually a virus that can be easily killed by soap and water, by disinfectants. So those should be our standards, right? So soap and water, hand hygiene gel or hand sanitizer, disinfectants that are standard that we use every day in our household. Other than, and we do know that it is resistant to heat. So when you cook your food, that's a good way to kill COVID-19 if it happened to be there, but we don't think that that's probably likely. But for those who are worried, heat does tend to kill the virus. So when you launder your clothes, the normal soap and water you use, using as high heat as possible. But if you have something that can't tolerate high heat in the laundry, that's okay. The soap will likely do the job.
That's good to know.
From a treatment standpoint, there really isn't anything that we know for certain treats COVID-19. We know that this is a disorder that is generally patients get supportive care, which means we give them fluids and we give them nutrition, and we give them oxygen, and we do those things when they're in the hospital. There is a new medication called remdesivir, which is a medication that we refer to as an antiviral, which means it actually kills the virus. It's been trialed in many places. We actually have been a part of the clinical trial looking at remdesivir. The data is not completely out, but it looks like it has a positive impact on the patients who have this virus. And because of that, it's been issued an emergency use from the FDA. So it is now being distributed by the company to various places in the United States to be used in patients who have a severe case of COVID-19.
Wow, that's incredible.
Yeah, good. It's good news.
It is good news.
I think more to come on that. Yeah.
Yeah. So you've talked about what maybe doesn't help, but is there anything that we can do to just try to stay ahead of it with our bodies, like getting exercise or eating well, or, are there any recommendations like that?
I think one of the interesting things that we've seen both nationally and internationally is that healthier people tend to do well. As we age and as we have more medical conditions, the likelihood of someone having a worse outcome with COVID-19 goes up. So I think the best thing that we can do is to try to keep ourselves healthy. If you have a chronic condition, try to keep that condition under control. So for example, if you have diabetes, really working hard to try to keep your blood sugars under control, to keep you as healthy as you can be. And then everyone should do the normal things. I think sometimes we forget about those normal things. We think about diet and exercise all the time and how we can keep ourselves healthy. But I think also we should be thinking about sleep. Sleep is very important in normal health. And with this virus, hydration, it has become important. If we were to get the virus, becoming dehydrated is likely and probably is a precursor to a worse outcome. And so keeping ourselves hydrated, lots of water is a good idea. And then, get care from your doctors. Keep in touch with your doctors and make sure that if you need to go in, that you're going in to get your care. I think we'll probably touch on this a little bit more, and I suspect that some of the viewers have questions about this. But if you have a medical condition, that's something that could harm you. And I want to be sure that people understand that hospitals are open to take care of patients. We have done a great deal in our hospital and in many hospitals across the nation to make it a safe place for people to get their care. It would be terrible for people to have a worse outcome from the condition that they know they have because they're avoiding getting care for that because of a condition that they're worried they might get. And so taking care of yourself, I think, is the best thing that you can do.
Great. Thanks for that advice. So the next question is, do you think the precautions we've taken, such as social distancing, face coverings, washing our hands more for the appropriate amount of time, do you think all those have helped us stay safe and avoid a surge of new cases?
I do. Absolutely. For those of you who have been monitoring the models, they've changed remarkably. And one might say, well, maybe the model was just wrong in the beginning, and I guess that's possible. But we do see that some states have been more successful in controlling the virus and some in others. And we know that when we're unable to follow those recommendations, like social distancing, that outbreaks can happen in places where people are confined. So I do believe that these safety standards that we have put into place here and across the nation, the recommendations of washing your hands, wearing a face covering, keeping social distancing, have had an impact on this virus. There is one outcome that perhaps has been an effect of this that maybe people aren't aware of, and that is perhaps the virus has decreased the spike, but it maybe is plateauing for a longer time. So it may be that we see it a little longer because we're doing this, but the goal would be for less people to be infected.
Yeah. So how would you respond to a patient or even someone you know in your personal life that believes that social distancing and wearing face coverings in public are meant to make people fearful of this virus?
Yeah, it's a sad thing to have to think about that. But certainly, we don't want people to be nervous about good practices and think that people are putting them into effect to harm them. I can certainly understand why that could be the case. I mean, we see things on the media regularly, and certainly there's a lot of skepticism and there's a lot of speculation about things that cause people to really distrust. But I think that what I would say to you is that we clearly know how it's transmitted. We know that outbreaks happen. We know that people have gotten this virus, so the virus is real, and that these are common standards that we would take with any other infectious disease that is transmitted through droplets. And so it saddens me to think that we might be distrustful about standard medical recommendations. But the reality is these are the things we need to do to control the spread of this virus.
All right. So we've got a couple of questions from Facebook. Patsy asks, do we have any idea of when we're going to allow visitors at the hospital again?
Yeah, it's a great question. We really look forward to that day because we know that having loved ones around us when we're sick is really important in our recovery. Right now, we don't have a date that we're going to lift our visitor restrictions. We do keep having conversations about this, and what I can tell you is that we will do it as soon as we feel that it is safe, both for our patients, our visitors, and our faculty and staff. But right now, that isn't in our near future.
Great. So this is a question about a different kind of visitor. Justine asked, if my kids don't live with me and I want them to come home for a visit, do we need to have them quarantined for 2 weeks when they come home? Do you have any insight on that?
Yeah, that's a tough one. You know, it kind of depends on your age. I would say, Justine, if you're older, if you're in your 70s, maybe you want to have a conversation about whether they should come home. Because we want to try to limit your exposures because you are in an age group perhaps that could have a worse outcome if you were to get COVID-19. If they do come home, I would strongly suggest a conversation and maybe even a mandate that staying home is really the best thing to do, because whenever they go out into a public place, interact with friends, etc., there is potential for them to be exposed, and they could bring that back to you.
Right. So this is really an individual basis, just evaluate your situation and really the circumstances in your life and make the best decision for you and your kids' health.
And then a conversation about social distancing is always good, even if they're not coming home, to keep them safe.
You're always their parent, right? Even if they don't live with you.
Right.
So if you're just joining us, I'm here with Dr. Teresa Brennan, Chief Medical Officer at UI Hospitals and Clinics. And we're talking about some of the myths around COVID-19, and she's providing us with some great, accurate facts so that we can all keep being safe as we move forward. So our next question is, if you've been tested for COVID-19 and your test comes back negative, can you test positive at some point in the future if you're exposed to the virus?
Of course. It hadn't occurred to me that actually that this might be something that people might think is the reality. So the test for COVID-19 is a PCR test, a polymerase chain reaction test that looks for the antigen. It looks for the virus in your, basically the back of your throat. The swab is done, and then they look to see if the virus is there. So that really depends on if the virus is there at that moment, right? So if I get diagnosed with COVID-19 today, if I had a test, a month ago, it would have been negative. And if I have a COVID-19 test today and it's negative, thankfully, and in 2 or 3 weeks I get exposed and I actually come down with it, at that point in time it would be positive. So it doesn't preclude you from having a positive test in the future.
Great. Thank you for explaining that. How are we treating patients who have not tested positive for COVID-19 but are presumed to have it? So if they've got the symptoms, but they don't have that positive test.
Right. So the symptoms are somewhat nonspecific, but there's some things that when those symptoms come together, that it is very likely that they could have COVID-19. The test is not 100% perfect. And so there are people who have it, who we test, who could come up negative. That is a possibility. The likelihood of that happening is very, very, very low, but it is a possibility. And then many institutions are really testing according to guidelines, whether people meet guidelines for testing. And it is possible that someone who doesn't meet those guidelines could be presumed positive. What we're doing at University of Iowa Healthcare is that the physicians and practitioners that are seeing the patient and doing that test in clinic, that group of people are actually continuing to follow up with patients that are labeled as presumed positive. And even some that aren't, some that it's not entirely clear what their symptoms are, they're getting a follow-up call or maybe multiple follow-up calls depending on how they're doing. I think that's really important. What we've learned from our home treatment team is those routine interactions with patients can be really helpful in helping them to be doing the right things to take care of themselves, whether they're COVID positive or not. But we're really focusing on the COVID positive with the home treatment team. But for the others, we are calling them after they are seen for their original time and just making sure they're doing okay. And also, if they're presumed positive, we are giving them instructions about quarantining themselves and isolating themselves to make sure that they're not transmitting it to other people.
Right. Well, that actually touches on another myth that is out there, which is that some hospitals are unnecessarily coding patients as COVID-19 patients when they don't actually have the virus. I'm not exactly sure why that myth is out there or what purpose it serves, but can you shed some light on that and why that's not happening probably?
Yeah, I mean, I can't speak for other institutions. I can tell you that we determine a patient to be positive if they have a positive test. And it is a reportable infectious disease, so it has to be reported to the Department of Public Health and ultimately the CDC. And that's where all these numbers come from, right? So you have a laboratory test that shows that it's positive, and that's how the diagnosis is made. As we just talked about a little bit, there is a small number of people who may be termed presumed positive. In some of those people, we may go to other lengths to get a diagnosis. For example, depending on the stage of the disease that you have, the virus can be mostly in the back of your throat and in your upper airway. Later on in the disease, it may be in the lower airway down into the lungs. And sometimes an institution may have to, with the discussion of the patient, actually go to further lengths to get that sample to test. The presumption is high that this is what the patient has. It's important to make a diagnosis for a couple of reasons. One, because it's publicly reported that this is a reported disease, not the person's information, but just the fact that a person has this. It's important to make the diagnosis. The other thing is for us as physicians, if we rule that diagnosis out, then we have to be looking at what other diagnosis may be causing that patient's symptoms. Sometimes we will go to greater extents to get that sample, like something called a bronchoscopy, where we will put a tube down into the lungs and actually take a sample from there. A lot of that's really dependent on the timing, where that person is in the course of their illness. So I don't know what to say about the concern that other hospitals may be calling people positive when they're not. It's unfortunate if that's the case.
Yeah. Well, thanks for that explanation, because that's I think you hit on something really important. If it's not COVID-19, we want to get to the bottom of what is causing that person to have an illness. So it is important to find that right diagnosis. So the next question is, the Iowa Department of Public Health is releasing information daily about the number of cases in the state. Can you explain how increased testing can affect the reported number of COVID-19 patients?
Sure. Because the vast majority of the numbers that you're seeing are patients that have had a test and it's been positive, I don't want us to get too confused about this presumptive positive, because if it happens, it's a very, very small number of people. But the numbers that are reported are having a test and being positive. So if you take a group of 100 people and you say, we're going to create guidelines that say that even though these 100 people have symptoms, we really, the testing is limited, so we can only test 50 people, and half of those people have it. So these are made up numbers. That's not what we would see, but just to make it easy. Then you would say 25 people have it, right? But if you tested everybody and that percentage was the same in both of those groups, it would be 50. So when you're not testing people, you can miss people that can have the virus. And we certainly see when outbreaks happen, the Iowa Department of Public Health has mandated that certain areas test everyone. And when everyone gets tested, then you have a more accurate number. And so the more we test, the potentially higher those numbers will be. So some people will speak to how, because testing has been limited, both in Iowa, nationally, and even internationally, that the number of cases may be underestimated.
Right. Dana from Facebook asks, why do the recovered numbers seem so small? Is there a lag in reporting?
It's possible that there's a lag in reporting because recovery, it's easy to say when someone has it, right? Test is done, positive test, someone has it. It's a little more challenging to say when someone's recovered. The CDC says that in order to be recovered, you need to be out 10 days from the onset of your symptoms and not have fever without using medicines like Tylenol or ibuprofen for 3 days, for 72 hours. So that would mean at least 10 days and likely a little bit longer, but it's really dependent on the symptoms going away. We know that we can call people recovered after about 28 days. So if the symptoms are unclear or the patient is quite sick and in the hospital for a long time, that recovery may be longer. It's important to remember and to recognize that when a test is positive, and then you have those 10 or 14 or 21 days until someone could be recovered, that there is that lag. And so it's really only when this is all over that we'll be able to know for sure what the mortality is, meaning how many patients die who get it, and what the recovery rate is. So there is a bit of a lag in just in timing because of the disease course.
Sure. So do we know how the virus originated or how we got this version of the coronavirus?
Yeah, we don't really know. I mean, throughout the course of history, new infectious diseases have occurred. And it's possible that these viruses or bacteria, in other cases, have evolved and new strains have come up. It's possible that we've changed a bit that make us more susceptible to them. But we believe that this is just natural history. I know that there's a lot of skepticism and suggestion that perhaps this was done intentionally. I think that we should probably avoid making those comments until we know for sure. So right now we believe that this is just another new virus, as we have seen throughout the course of history.
Right. So Jamie from Facebook is asking, is there anyone that should not wear a face mask, such as those with COPD or other airway diseases? And then she also asks, is there any concern with CO2 retention with face masks?
Yeah, that's a really good question. There are people that likely should not wear a face mask. The first group is those that are under 2. So, and that really leads to the second group. So the reason that kids under 2 probably shouldn't wear a face mask is they probably couldn't get it off easily. So other adults who might have some dementia or some physical disabilities that wouldn't allow them to take the mask off on their own, those would be people that we would want to be very careful about and maybe shouldn't wear a mask. The group that you're talking about, I think, is a very interesting group. When you put a mask on, you're rebreathing your own air to some extent. And the idea of you rebreathing the byproducts that you breathe out, like carbon dioxide, is a potential concern. I don't think we have any data on that, but what I would say is that we generally say that people that have trouble breathing, which would mean maybe people with COPD, maybe shouldn't wear masks. Those would be people that would be high risk. And so you have to balance. The best scenario maybe is to not put themselves in a situation where they have to wear a mask. And then the second best scenario would be to potentially wear it for as short a period of time as possible. Again, we don't have any data that it may worsen their health condition because of the CO2, but it should be something that people with COPD, particularly advanced COPD, should be cognizant of.
Great. Thanks for that explanation. So we're really pivoting to a different subject here. There's some confusion about how hospitals are using federal aid in the fight against COVID-19. Can you provide any insight about this?
Sure. I think it's important to recognize that the government has helped many of us. If you think about the individual or the small business owner or even the healthcare facilities or hospitals, the stimulus check to the individual is to help the individual. Small business loans to keep small business open has been very important to many businesses in our community. And then the support to hospitals really is those dollars that you just spoke of that are really given to hospitals because they have because we need to keep our hospitals open. The University of Iowa Healthcare is just one, but when you think about even smaller hospitals in our communities, they may struggle as well because the costs of healthcare remain, the people, the facilities, et cetera, but the numbers of patients that are coming into the hospital may have decreased during COVID-19. And so those dollars are really there to help to keep those hospitals open by helping with those continued costs. I know that some hospitals have had to lay off people, and that's really a subsequent thing to the volumes changing and the revenues going down with the cost remaining.
Sure. So there are some rumors out there that hospitals are unnecessarily coding those patients as COVID-19, like we discussed earlier, but some people believe so that we can get more of that federal aid. Can you touch on that?
Yeah, the federal aid is really based on the number of Medicare patients that you've seen in the past. It really isn't based on the number of COVID patients you're taking care of right now.
Okay.
So I'm not sure that would be beneficial. It may affect the revenue that they take in from that one patient potentially. I don't think we know those details right now.
Okay.
But I hope that's not happening.
Well, thanks for touching on that and giving us your insight in that too, so that we all understand how that process works a little better. So let's see, do we know about the potential link between COVID-19 and the Kawasaki disease like illness that's affecting some children?
Yeah, so Kawasaki disease is probably, those two words are probably together, are probably something that most people have never heard of. This is a pretty unusual disease that really only affects kids. It's a disease that's really not been around that long in medical terms. Probably sometime in the late 60s, it was identified as a true syndrome or disease. It's a disease that there's inflammatory changes that cause changes in the blood vessels. And in particular, one place in the blood vessels in the heart that can be quite concerning. I don't think we know exactly what causes Kawasaki disease. There are speculations that it may be triggered by an infection, so that infection may trigger the immune system to do something it doesn't normally do and maybe isn't good for the person. So it is possible that COVID-19 could be a trigger. I think we're hearing in the media that there have been a number of cases, an increased number of cases. And as I said, particularly in the United States, this isn't a very common diagnosis. And so with that increased number, there's concern that there might be a connection.
Okay. So we obviously want people to take care of their health, and we want them to contact their healthcare provider if they're feeling sick. But are there any symptoms you can touch on that we really don't want people to ignore, and we really want them to reach out and ask for help?
Sure. So I think it's easy to talk about symptoms of a heart attack, like pain in your chest, pain in your arms, breathing troubles, unusual sweatiness, or other symptoms like a heart attack. Symptoms like a stroke, droopy face, numbness on one side of the body and not the other, weakness on one side of the body and not the other, slurring speech. Those are certainly things that we would always consider an emergency. I think there are other things that we should be cognizant of. Those emergent conditions that may be a new symptom that just doesn't go away and really is distressing or very severe to the patient. Those would be things that we would certainly want people to, as they would have months ago, sought medical attention for now. I think it's also important that we think about chronic medical conditions. I referred to diabetes a little bit earlier. Someone who has diabetes knows that it's important to take care of your blood sugar. And if the blood sugar is very high, for example, if someone has a blood sugar of 500, that would be very high and they would need to seek medical care. So making sure your chronic medical conditions are not becoming out of control. And if they did, that would certainly be a reason to seek medical care. And then I think also important to think about new things. And I think many of us think about the diagnosis of cancer. And so if you're noticing a lump or bump somewhere that is new and different, particularly if it's changing in size and getting bigger, blood in your stool, those sorts of things that we would normally be concerned about and seek medical care, I would want certainly people to be very cognizant of that and not ignore those. Some of the things we talked about require an emergency room visit, like chest pain and stroke symptoms. But some of the others just require a discussion with your doctor. And if you are worried about going to a hospital or a clinic to be cared for because of COVID-19, I would strongly encourage you to reach out to your physician's office and have a conversation with the doc or one of their staff about the concerns you have, the symptoms you're having, and really decide individually what's best for you. Our physicians are having lots of these discussions. And I think it's very productive. It can be very reassuring in some cases, or it can really get the needed help in an efficient way if something needs to be addressed. So really communicate with your healthcare providers, now more important than ever.
Yeah, and if you have a discussion with your doctor and you and your doctor decide that it's best to have an in-person visit, is there any reason that anyone should be worried about coming to our hospital or one of our clinics for that visit?
I mean, I think that there's a lot of reason people should worry. And I think worry sometimes is actually productive because it causes us to do things that we might not have done if we hadn't worried.
True.
I can tell you from our standpoint, we have very thoughtfully put a lot of things in place to make sure that this is a safe place for our patients and our staff. Really important that we are all wearing our face shields. I said a little earlier that Elizabeth and I are in rooms by ourselves. And we don't have our shields on. But when I leave this room, I will have my shield on, washing hands frequently, having hand sanitizer stations in more places than we used to, making sure that social distancing is something that we are constantly working on and enforcing. And we've even done a number of other things to keep our people, including our patients, safe. If you come to one of our clinics in our waiting rooms, you'll see that some of the chairs are blocked off. There might be a sofa-like chair where some of the seats are not available to you sit in, and that's really for that social distancing. And then the last thing that we are doing is anyone who comes to get an operation, a surgery, or most of our procedures will get a COVID-19 test the day before. And that just helps us to know the patient's status and also to know how to care for them safely and make sure our staff stay safe. So with all of those things and many other things in place, we feel like this is a very safe place to come. And I know that many hospitals have done the same. So I would really encourage people to make sure you're taking care of yourself. We talk about adult patients a lot, but I guess I just want to make sure that we're talking about pediatric patients too. Many kids go in for a well child check. And if they're well, maybe they don't need that. But I think it's really important that we make sure kids are growing appropriately, that they're developing appropriately, and also to make sure they're getting their vaccines. And so those are all good reasons that connecting with your doctor And if you need an on-site visit, to follow all those safety standards as we are, and to get that help that you need and that care that you need.
Yeah. Well, thank you for joining us and for helping us better understand the facts about COVID-19 today, Dr. Brennan.
You bet.
And thank you for everyone who tuned in. If you tuned in later during the broadcast, make sure to go back and watch from the beginning so that you can get all the great information that Dr. Brennan presented to us today. And stay tuned to the UI Healthcare social media accounts and our website, uihc.org, where you can find the most up-to-date and accurate information that we have available to us about COVID-19. And remember, please wash your hands for 20 seconds as often as you can, practice social distancing, and seek out reputable, accurate information whenever you can. Thanks for watching.
Absolutely. Stay safe.